So these are your twins. This is Zoe. Both are 8. Both are, God willing, healthy. Take no medications. Everybody's fine. Awesome. Awesome. Perfect. Fantastic. So this is going to be a relatively quick procedure for both. Probably you want to allocate at least half an hour each. At least half an hour. Get yourself 45 minutes on your schedule each, just to control bleeding, give yourself some time to suture, and to do it properly. Okay. So interestingly, both twins have a very similar frenum pattern. I think Addie's frenum goes a little bit more interproximal than Zoe, at least from this angle. But we're going to treat it just the same. And I think it's great that you diagnosed that they both need it, because you see that the frenum attachment, we're looking at Zoe, is pretty close to the gingival margin. Okay, so if you pull on the frenum, sometimes you'll see a little blanching on the margin, which tells you, this is just a troublemaker. We need to get rid of it. With Addie, the frenum actually goes interproximally. So you have to be careful when you resect it, not to take away anything from the interproximal tissue, which is obviously important. So we'll keep our incisions very, very superficial. So what I'm going to do next, I'm going to give you a little kind of a rundown of how to make the incision. So I think the best thing, tell me if you can still see, we'll start with Zoe. Can you still see Zoe right now? Okay, so you see kind of just her name, and you see the clinical picture, and you may see me on the side. Is that true? Perfect. I'm holding a phone. Okay. And let me see if I can use a pen. Okay, so we got a pen. So a frenectomy has 3 parts, 3 movements, and you watched some of the videos already. So this may be a repetition, but now we are repeating the same movements as it pertains to your VIP patients, right? Okay. So the first thing is local anesthesia, obviously. You want to infiltrate the vestibule. In Zoe's case, that's enough. You don't need to do more than that. For Addie, you may have to give a little bit of palatal infiltration in case there's a crossover in terms of the innervation from the palate. So you'll see how she feels. If she feels something, then you add something on the palate. If she doesn't feel anything, then you're good, because as you know, the palatal injection is quite uncomfortable, especially for kids. Now, don't infiltrate the frenum itself too much. Meaning, I'm just going to kind of make a couple of points here. Okay, so you want to anesthetize between the distal line angles of the centrals. Okay, no need to go farther back, but don't give too much inside the frenum itself. Why? Because it'll blow up like a balloon, and you'll lose your orientation. You may resect too much tissue, you may resect more than what you need. So you need to give some, but don't be too generous. Is that point clear? You don't want it to be like ballooning up and crazy big, and you need to wait half an hour until it goes down. So anesthesia is out of the way. So now the best way is for your assistant to hold up the lip, ideally with her fingers, with a piece of gauze. And similar to what Zoe is doing right now. I think she's holding her own lip. So pretty similar, because you will want to hold a cotton pliers with your left hand and a 15 blade with your right hand, and only focus on the first movement. What is the first movement? The first movement is detaching the frenum from the attached tissue. So I'm going to make a little outline here for you. So just follow the attachment of the frenum. okay? And you'll hold the blade parallel to the attached tissue. Okay, so with one hand, if you look at my video here, you use cotton pliers, grab the frenum, and with the number 15, you'll just dissect it out parallel to the attached gingiva. Parallel, completely parallel. You don't need to go deep, keep it completely parallel. So sometimes it helps if you hold it, go from the left and then come back from the right. But sometimes we do this in one clean swoop, okay? It doesn't really... The cotton pliers are around the middle of the frenum, around here. I'm going to make a little circle. Okay? Something like that. So this is movement number one. What's going to happen after that? The frenum that is now looks pretty big and kind of triangular. It's like a spring, like a rubber band. It'll now attach only to the mucosa. You see a little dangling part, and now you have to dissect this out. And the way you dissect it, again, now you grab from the end. Now you grab it here, and now you dissect it out from the mucosa. This is where dentists are a little bit shy about it. Like, oh, how much do I remove? Well, if you give too much anesthetic, you won't see. You won't see the original frenum size. That's why we don't want to give too much. But, try to guesstimate. Even if you remove slightly too little or slightly too much, not the end of the world, because you'll be able to approximate and close it up. Okay? So, second movement is dissecting the frenum from the mucosa. So again, grab it closer to the end, pull it away, and then with a fresh blade, okay, don't use the same blade. You change it, or you reach out for a new blade or two new blades and just dissect it out. What you'll see then is a gaping hole. Okay, not gaping hole in terms of depth, meaning like something you can put in there, but the mucosa will stretch and look sometimes impressive. And then comes the time for the third movement, and that's where you make those periostal cuts. And I'm just drawing on top of the frenum because this is a static picture, but then you make a cut right basically where the lip meets the mucosa, the attached tissue. Not the keratinosis, the mucosa. And that's the third move. And that's meant to scar the tissue down and creates a little scar so the frenum doesn't reestablish itself. Okay? And then these are the three movements. Now the last part, it's not a movement, but it's the last part of the procedure, is suturing. Okay? So the suturing is done horizontally. Okay, so you're suturing. If you have, and I'm going to draw it here on the lip. I'm actually going to draw it here. I don't want to offend Zoe. It's going to look like that. Okay, it's going to look like a gaping hole. Let's say this is the mucogingival junction. So there'll be a bleeding part here. Okay, that's the part that you detached, right? That was movement number one. Okay, and here you'll start seeing something like that. Okay, something like that, like a mouth or a diamond. Some people call it a diamond. Okay, because you resected the frenum. That's the pattern you see. A mistake is to suture it vertically. You need to suture it horizontally. So engage here, put a suture. Okay, from here to here, from here to here. So that's going to close it up. Okay, close it up. If you close it up in vertically, you're recreating your frenum, you're limiting your vestibule, you're narrowing down your vestibule. Plain gut. You'd like to use chromic gut? Go for it. It doesn't matter. It lasts longer. But use a 5-0. Okay. Now, let's move on to Addie. Okay? Same, just a little bit different. Okay, she has to be different because she has nail polish, right? It's not that different. All you need to make sure is, and we're just going to outline it here. It looks, at least from the picture, it looks like it goes a little bit more into proximity. It doesn't go all the way to here. So I doubt if you need a palatal injection, but it's the same. Perfect, exactly. 2 by 2 here with the assistant, just to keep it open, keep it stretched up. And same thing when you suture. Pardon? Exactly. It's going to jump. It's going to kind of jump to the mucosa, right? Like a rubber band. And then you do. This is movement number one. Movement number two. Okay, and I'm drawing it as you speak. Okay, kind of to show you the little triangle that you'll be getting. So all this will be removed. So that's correct. Exactly. You got it right. You got it right. And what I suggest, you treat Zoe first, just so you have a little kind of recap of what we talked about. You treat Zoe first, and then you treat Addie. I would do this the same day, and that's it. There's not too much post-op follow-up. Meaning you'll give them some the medication they're used to take. At this age, they're not used to taking they're not used to taking pills. So you have you're a dad, so you know what we give kids. Same thing. Give them ibuprofen or Tylenol. Okay, liquid. And they will complain the first couple of days because when they smile or function, talk, the lip will stretch the sutures and the incision line, and that's going to hurt a little bit. So it's good to ice it a little bit. That's hard. No smiling for 2 days is hard. But that's in essence what you need to do. Yes, we have one coming up. We're working on the next one, which is the implant gold rush. You signed up for that. That's awesome. That's really good. So you'll get probably in about 2-3 weeks. You'll get an email from me with the link to the course. It was included. It's one of the bonuses. This component of it at least, and we'll interact more. Okay, buddy. Good. All the best. You too. Bye bye.